Good evening. Thank you for joining us once again. Welcome to this Ask the Expert Health Tech Panel session hosted by the Healthcare Leadership Academy. My name is Liz and I'm delighted to be your host this evening. A little insight about the Healthcare Leadership Academy for those joining us for the first time. We're a social enterprise that delivers programs to equip healthcare professionals in the core areas of leadership, quality improvement, and management. You can please visit our website at www.hlaafrica.org for more information about us. Today, we're excited to cast a spotlight on digital healthcare innovations, the existing gaps, and how we can advance these solutions to improve patient-centered care outcomes. It's no doubt that there's a growing attention to the role that technology can play in improving access to healthcare and providing solutions to the most pressing health system challenges. When you think about it, the COVID-19 pandemic highlighted how critical innovations are in solving complex problems in healthcare. So it's very important for us to examine the different moving parts of the digital health space and see how to move from a nice to have to a need to do. We'd like to remind us that this is an opportunity to get answers to your questions. So I encourage you to look at the chat box and drop your questions. We'll take them in the order in which we receive them. This evening, we are joined by very special guests who are seasoned industry experts in the field. Dr. Temi, Filani, Mr. Emesibe and Dr. Chibuzo Opara. Thank you so much for joining us this evening. To begin, I'd like to share a little bit about our panelists by reading their bios. And as we say, ladies first. So Temi Filani is a medical doctor and senior public health professional, passionate about expanding access to high quality healthcare services on the continent. She currently leads the public health practice in Co-Creation Hub, delivering health tech solutions to address some of Africa's biggest healthcare challenges. Prior to this, she worked with the World Bank and with several healthcare consulting firms, working on healthcare quality, universal health coverage, and other areas. She's also the co-founder of the nonprofit BloodPlus initiative, looking to bridge the demand and supply gap of blood in Nigeria. Dr. Temi is considered a thought leader in healthcare quality improvements and has the ability to evaluate, design, and implement population-based projects to strengthen health systems. She has a master's in healthcare quality and safety from Harvard University, a medical degree from Ryazan State Medical University, and a postgraduate diploma in public health from the University of York. Welcome, Dr. Temi. Emesibe is an engineer and technology entrepreneur with over 18 years of experience designing scalable enterprise products and services. His expertise covers solutions, architecture, automation, product strategy, and innovation management to solve business needs. He co-founded Cloudonly, an HR and payroll management platform, and Cornie Health, a digital health practice management platform. And he currently serves as co-CEO and CEO of Cloudonly and Cornie Health Technologies, respectively. Besides his duties as co-CEO and CEO, he is equally responsible for product strategy, innovation, and architecture. He has impacted the ecosystem and contributed significantly towards developing enterprise-scale applications that address open authentication, identity and access management, approval workflows, multi-carrier logistics, and a fast healthcare interoperable resource-based digital health infrastructure. Sounds like a bit of a mouthful, but we'll get to know more about this later. Before venturing into technology startups, he spent 13 years plus at MTN Nigeria, where he was responsible for MTN Nigeria's core transmission architecture design and capacity shaping until 2017. He holds a Bachelor of Engineering degree in Electronics Engineering from the University of Nigeria, Nsukka, and a Master's of Business Administration from the University of Bradford, United Kingdom. He is passionate about homegrown innovation and its potential for African prosperity. Welcome, Mr. Ene. Dr. Chibuzo Opara is the co-founder of DrugStoc, a cloud-based healthcare, IT, and logistics platform, which improves access to quality pharmaceutical and healthcare products for healthcare facilities and pharmacies. DrugStoc is focused on eliminating counterfeit drugs within the pharma value chain while improving the supply chain of health facilities and pharmacies across Nigeria. He's a health economist with over 12 years of experience in the health sector. He's worked for the European Union, the World Health Organization, the World Bank, and the International Finance Corporation. His work experience spans across different aspects of the healthcare system and across several countries, including the Netherlands, Nigeria, Belgium, Switzerland, Liberia, Kenya, Vietnam, Cameroon. During this time, he built up extensive experience in the fields of primary healthcare in Nigeria, including supply chain logistics, healthcare financing, human resource planning, task shifting, and health facility management within the private and public sectors. While working with the International Finance Corporation, Dr. Chibuzo spent his time providing technical assistance to the Federal Ministry of Health, alongside the Pharmaceutical Council of Nigeria, on reforming the Nigerian pharmaceutical regulation in order to make them more market-friendly. In the last 5 years, his focus is energy, time, and passion in expanding access to good quality pharmaceutical and healthcare products by leveraging on DrugStoc, a pharmatech platform which he co-founded. He holds a degree in medicine and surgery and another in economics, policy, and management from the University of Maastricht, the Netherlands. Welcome to our esteemed panelists. Thank you for joining us this evening. I'd like to also remind us once more that our webinars are opportunities to get answers to your questions. So please look at the chat box and drop your questions. We'll take them in the order in which we receive them. I would like to ask everyone to, once again, please mute your mics, switch off your cameras, and let's get right into it. So I know that we've read the profile of our panelists and gotten a sense of their background and career journey, but I think I'd like to start by asking, would you each briefly just share your journey into healthcare technology, the motivation behind it, the gap you were looking to fill, and what you're currently focused on? So I think we can start with Mr. Ene. Mr. Ene, you're welcome.
Can you hear me?
Great, we can hear you now.
Okay, thank you, Liz. Hi, everyone. I'm happy to be here. So I've spent most of my time in employment working on enterprise solutions, and I was happy doing what I did. So it was easy for me to, naturally venture into enterprise tech. And, saying that healthcare was, a natural, every one of us have had, an experience directly or indirectly, related to suboptimal healthcare, delivery arising from, a broken and fragmented healthcare system. So we decided to venture into healthcare. Cornie Health is our effort to contribute to closing the gap, by facilitating better healthcare operation driven by data and patient engagement. So essentially, Cornie Health offers a usage-based practice management system for providers and a free self-service portal for patients. Okay, so that's our journey in health tech. And for those who may be interested to learn more, I will subsequently drop my contact details in the chat in due course. Thank you.
Wonderful, thank you, Mr. Ene. Dr. Temi, would you like to, the mic is yours.
Thank you very much, and good day, everyone, and thank you so much for taking time out to join us today. So for me, how did I find myself in health tech? So I had spent a couple of years, about 8+ years in public health, and I had started to deepen my expertise in quality improvement. And of course, when you're thinking quality improvement, there's a place for technology and how technology can be an enabler. So the opportunity to join CC Hub, which is Co-Creation Hub, arguably one of the largest tech and innovation organizations on the continent. The opportunity to join them to do great work came up, and I decided to jump on that ship. So basically, we leverage technology to address Africa's most pressing healthcare challenges. And it's been an exciting ride doing that. There's a lot of work that we've done. I would also drop details of our website in the chat box so that you can take a look to some of the exciting things that we've done. And we're more than happy to also get people join the bandwagon and support the work that we're doing. Thank you very much, Liz.
Awesome. Thank you, Dr. Temi. That'll be very helpful. Dr. Chibuzo, the mic is yours. If you could please.
Hi, everybody. Very excited to be here.
Can we see you, please? I think your video is turned off.
Oh, sorry about that.
Okay. All right, brilliant.
Great. So essentially, my background is I'm a medical doctor and went into the field of finance, seeking to try finance and policy, seeking to try and tackle those challenges, the systemic challenges that had to deal with that were around, the essential issues with delivering healthcare that were not clinical. And I had personally faced some challenges while practicing that led me to the realization that, as much as we don't have enough clinicians, human resources for healthcare, we were also bleeding a lot just in terms of efficiency of healthcare systems and being able to deliver healthcare properly by inefficient supply chains, by inefficient deployment of human resources, inefficient deployment of financing around healthcare. And that led me to that. Diving further into the rabbit hole, essentially led my co-founder and I to start up DrugStoc, which is a cloud-based pharmaceutical distribution platform that connects manufacturers of good quality pharmaceutical products to hospitals and pharmacies. And we were tackling the challenge around fragmentation in the pharmaceutical supply chain space by ensuring that patients, hospitals, pharmacies, and healthcare providers alike could have access to good quality, cost-effective pharmaceutical products when they needed them, where they needed them, how they needed them. I've been doing that for a while, and it's been quite rewarding because for us, we've seen the quality in the space go up in these years, and even more than the supply chain impact for us, the quality of care impact is one that we had underestimated that would happen, and we're quite excited about that space. And leveraging technology has obviously for us created access beyond where we would have done this without the use of technology. So quite excited to have this conversation and be in this space and listen to questions and folks and all the fresh new ideas of what's happening and what's going to happen and drive this conversation forward. Thank you. Excited to be here.
Impressive. Thank you, Dr. Opara. That ties in beautifully, into what we're doing here this afternoon, especially around the increase in quality of care. And while the mic is still with you, even though you've turned it off, but I want you to turn it back on because I want to ask you the very next question. From your cross-continent experience of health financing, economics, and policy, which you highlighted, and with your experience co-founding DrugStoc, what are the opportunities or leverages that exist for mass adoption of healthcare technologies in Nigeria and in Africa as a whole? And I'm asking this particularly because I imagine that you've sort of interfaced, both from the investor and innovator's perspective. So do you think that Africa in general, Nigeria in particular, is ready for the full-scale deployment of innovative technology in healthcare delivery?
Thank you for that. Very good. That's a great question. So when you look at the space, right, what you see is that there are certain challenges that are common to all of sub-Saharan Africa and all of certain parts of the world. In sub-Saharan Africa, you have an issue with affordability for care. You have an issue with access. Whether it be financial access, which goes back to affordability, or it be geographical access, or just access around distribution or reach of the product, or not enough human resources to elaborate the service. And when you look at other parts of the world, these issues are beginning to converge because in other parts of the world, there's an increased medicalization. All over the world, there's an increased medicalization of systems where a lot more people are beginning to consume care. But at the same time, we find that a lot of countries are also getting older. Japan, the US, a lot of countries in Europe are also getting older. And what happens is that as people begin to consume more care, it then becomes very imperative for the drivers of the healthcare system to produce and provide more care. And that's the same thing we're seeing in Sub-Saharan Africa. So Africa is plagued by infrastructure challenges. Africa is plagued by affordability issues. Africa is plagued by a dearth of human resources. And all of these challenges provide huge, massive opportunities. One, because technology is a great enabler. The way I like to describe technology is, let's say a doctor was going to see 5,000 patients in a week. With technology, he's able to see 50,000 patients. Let's say a pharmaceutical product was going to be available to 100,000 patients. With the use of technology, you can make the same pharmaceutical product available to over 1 million patients. And that is where technology gets to be leveraged, leapfrogging these infrastructure challenges and providing more access, which drives down prices in a very interesting way, because simple supply and demand economics, the more you have, the less it costs. So from that perspective, huge opportunities exist where there are huge challenges. And I'd say that for the entrepreneur, these challenges create massive opportunities for people to make impact today, tomorrow, and into the future.
Wonderful. Thank you, Dr. Chibuzo. Mr. Ene, my next question is for you, and this sort of ties into what Dr. Opara was saying about the infrastructure issues. Your work and career progression, is a testament to multi-sectoral collaboration, and this is important to recognize because we cannot talk about health technology solutions in isolation. In isolation of clinical expertise, that's not enough. So with your experience as a tech entrepreneur and an engineer with noteworthy experience working for an internet service provider in Nigeria, can we talk about the availability and capability of internet infrastructure, which directly impacts uptake of digital health solutions? So in your opinion, what is the way forward to addressing the challenging realities of internet infrastructure? And how do we go, where do we go, where are we headed, and how do we get there? I think that's the question. I think your mic is muted, Mr. Ene, we can hear you.
Okay.
Okay, perfect.
You can hear me now, right?
We can hear you, yes.
So
Yes.
I was saying, in my opinion, the rate of internet penetration, quality of service, and probably cost are all factors that affect digital inclusion. Okay. If you look at Nigeria today, the last data from Bureau of Statistics, we have internet penetration somewhere around 69 to 70%. So in my opinion, I would say that we're making good progress. Okay. However, internet connectivity, have already been classified as a super social determinant of health. Given that it addresses other social determinants of health like employability, housing, and access to other social benefits. Okay. So for that sake, we should be aiming to go towards 100%, not 69, 70%. Okay. For quality of service, I believe the service providers are, always working to address that, because it will impact or it will help them ward off competition and protect their revenue base. Okay, so long as they continue to make investments in these areas, that's coverage on quality of service, I think we eventually become okay. When it comes to costs, the cost of data is compounded because of the quality of service issues. A typical health provider will have to, have a primary service provider and still make effort to have a backup plan. Okay, that increases the cost of data. But I think what we need to do, well, before then, I think that ultimately these prices or the cost will be moderated by competition. But before then, I think what we need to do is to go in, to help us to continue to drive forward. We must adopt a digital inclusion informed strategy, across the board. And we'll have to equally support patients in their digital health journey, okay? And finally, providers must have to factor in the total cost of data, as an essential business utility, that helps them provide value to patients. Okay, that's where we are, and that's what we should be doing, to make sure that we drive forward.
Awesome. Thank you very much for that very succinct response, Mr. Ene. A follow-up question to that is, while I was reading your profile, I want you to just sort of shed some light so that we can get a sense of what is the relevance of a fast, interoperable healthcare-based digital health infrastructure. What does that mean in layman terms, and how does that impact the internet infrastructure for adoption of digital health solutions?
Okay, FHIR, Fast Healthcare Interoperable Resources. It's an open health IT data standard. It's pioneered by SL7 and supported by WHO. In a layman's language, it provides a common language and data structure that enables interoperability between systems and devices. So if you further explain that, what it does is, today, let's take Nigeria as an example. We have several, virtual health vendors, and we'll have different, health software vendors, okay? But the question is, are they able to interwork? Are they able to share health data? And sharing health data in itself is not interoperability. Interoperability means, the ability to share this data and to be able to meaningfully use the data. If you share the data and that I cannot interpret the data and use it, then it's not interoperable. So what FHIR does is that it provides a standard, across the nomenclatures of medicine and the data format. So if you send me something like a prescription note or a case history, okay, and I'm using a different system, or a provider using a different system, you're still able to interpret it and use it accordingly. And how does this affect healthcare? Let's take, for instance, I go to a hospital A who is using a typical, let's say, one software system, and tomorrow I go to another hospital, okay? If I'm not able to move, if my data is not mobile, then there's no interoperability, and the continuity of care cannot be guaranteed. The other thing to say is that FHIR today, it's already global, the most widely used standard, okay? Large cloud service providers like AWS, Google, IBM, Oracle already offer FHIR servers. Additionally, you have other people who offer, FHIR exchange platforms. So they have health, software vendors integrate on their platform, and then they act as a clearinghouse to make sure that these data can interwork and add value to, the patients and providers. So that's how FHIR comes in.
Awesome, thank you. Something that stood out for me was the way that it impacts continuity of care. And, because today our conversation is centered around patient-centered care. And one of the elements of that would be how care can be continued, how care can be bespoke regardless and tailored to the patients, of course. So thank you very much for that response. Dr. Temi, I have a question for you. This is around your, not what you're doing primarily now, but the nonprofit that you co-founded, BloodPlus Initiative, looking to bridge the demand and supply of blood in Nigeria, which, as we know, is a key healthcare delivery gap, and in fact, a major cause of maternal mortality, according to the World Health Organization. Can you tell us a bit more about the design of this solution in addressing the problem, the challenges you've encountered so far, and the critical contributions that we need to navigate from where we are to where we need to be in light of those barriers?
Absolutely. Thank you very much, Liz. So in the course of my work, I've had the opportunity to sit in on, conversations with policymakers and people who have capacity to make changes in the healthcare space. And, while problem solving and trying to unpack mortalities and drivers for mortalities, oftentimes we always talk about blood, like the conversation of blood always comes up. And as a major contributor to mortalities, like you said, it's a major contributor to maternal mortality, for example. So it just came to me and my partner while I did that how is something that is so available also so unavailable and causing so much in terms of avoidable deaths. And that was really where the whole concept of BloodPlus came about. So what we tried to do is we support blood transfusion agencies to foster a culture of identifying and retaining voluntary blood donors that are non-remunerated. And we see that that is one of the key areas that we need to address if we're trying to bridge the gap, of course, of demand and supply for blood and blood products. So we sit together with the agencies and think about, designing something that's appropriate for them, and then we implement. We try to be innovative as much as possible and as our resources would allow us to be, and we support them carrying out drives and all of that. Some of the biggest challenges we've encountered doing this, I think one of the most interesting things is around the conceptions of blood donation. So think about the cultural beliefs and how that can actually tint people's conception about donating blood, and people are uncertain what their blood is going to be used for, potential implications of that and all of that. So there's that gap, there's that misconception that we really need to tackle. But beyond that, now more from the agencies and the departments, there are major issues around data availability and use of data. So how are we forecasting, how are we predicting how much blood we need, how are we tracking how much blood we consumed, and aggregating that maybe within local government areas, statewide, and even nationally. So that's something that is grossly missing. And of course, there's an opportunity for technology to play a role in helping address that problem. So these are some of the things that we're also thinking about. There's a lot of fragmentation. I think that's also tied closely to some of what I just said. So because we don't have visibility into what the other agencies or institutions are doing regarding blood, we're unsure how to coordinate. So that's also a major issue. And of course, there's a place also for tech to address that issue. And lastly, I think I'll just talk about logistics. So moving blood from the donor to the user, how do we ensure that it's timely and it's safe and all of that? So there's still a huge conversation around that. And also there is a place for technology for that. And we've seen that some players are beginning to disrupt that space, but there's still opportunities for us. So if I were to pick 3 things to prioritize and to innovate around, this would be the first 3 I would propose. Thank you, Liz.
Thank you, Dr. Temi. Thank you very much for that robust response. Just before we go on, I just want to make a special mention to appreciate the presence of the Commissioner for Health and Human Services, Ekiti State, Dr. Filani. Thank you for joining us this evening. We appreciate your presence. The next question I have is a general question for all our panelists, and sort of ties into some of the points that Dr. Chibuzo had mentioned earlier, and I think even Mr. Ina had also mentioned. The question is this: accessibility and affordability of healthcare services are already key concerns in real time, especially in developing countries like ours. So when we introduce the layer of virtual healthcare delivery, how can we leverage technology to democratize quality, patient-centered healthcare services? What are the emerging trends or practical measures that we can collaboratively put in place, I beg your pardon, to foster patient-centered user experience of digital health solutions? So I think we'll start with Dr. Chibuzo Opara, since you opened the floor on that note earlier. So Chibuzo, please. Thank you.
Thank you. So when you look at the space, right, there are quite a few innovation and technology that are making their presence felt. I mean, from the telemedicine platforms, which have brought healthcare closer to the patient. In that space, you have the Hudibias, you have you have tons of the telemedicine platforms that are currently doing that. You have the micro health insurance firms that are making health insurance more accessible. You have, it escapes my mind, but they recently closed early part of this year. The name will come back to me, but there's a ton of them in that space doing great work. You also have, obviously, the pharmaceutical distribution companies that are bringing pharmaceuticals to patients in affordable ways. You have those who are working on improving health financing around provision of services. You have those who are working around tokenizing diagnostic and laboratory services. The general trend, the reason why I mention all these players is the general trend around these innovations are improving affordability and expanding accessibility. And at the end of the day, right, what we've come to realize in the space is that, yes, there's a lot of movement of value, but it is not distributed in the right way that is equitable. So what happens is, in a very funny manner, healthcare is cheaper in Lagos than it is in the rural areas of Nigeria. And that might sound counterintuitive to a lot of people, but even the indices for healthcare are much better in Lagos than a lot of other places. And that's simply because of the fact that there's an agglomeration of these services that enables, these services to provide cheaper quality services. Now, with technology, what happens is that these services are driven further down the pyramid into lower socioeconomic areas where people can consume care in ways that make sense and are affordable to them and expand access. So I think for us at DrugStoc, what we like to say is that in 5 years, there will not be any health tech companies. There will be companies that use technology. And if you're not using technology, you're not going to be existent. And that is because these technologies that are the frontier of healthcare services right now are things that are diffusing rapidly across the space, because everybody's beginning to realize that you can leverage these technologies to enable and expand access. And I think we're in for some very exciting times. Typically, like all medical innovation, when it happens, it usually starts at the, unfortunately, at the upper and middle socioeconomic groups, but it quickly diffuses down. And we're beginning to see that. I would be very happy when these technologies that are prevalent in the urban areas of Nigeria start to get diffused into the rural areas and peri-urban areas and start to do a lot more impact. And as a player, I do realize there's a lot of gap and a lot that can be done in the rural areas and should be done. And these are things that we speak about in our circles of entrepreneurs on how to improve and increase this impact in the rural areas. But I think it's something that is happening slower than all of us want. And I think it's something that will continue to happen. And over the next 5 to 10 years, I'm very confident that the face of healthcare will be transformed through a myriad of ways, both in the public and in the private space. Thank you.
Awesome, Dr. Chibuzo. So I like what you said about how that we won't just have health technology experts, but companies using technology. Very, very important. Dr. Temi, would you like to share?
Absolutely.
Your mic is turned. Okay, awesome.
Yes, absolutely. So of course, we cannot understate the role of technology. And I think like Dr. Chibuzo also said, the role of technology in ensuring that access to healthcare is met. So tech is critical. We've seen how it has tremendously increased utilization of healthcare services. Think about COVID and, in the thick of lockdown, how else would we have survived if we did not have technology? So there really is a critical role for technology in, this conversation. But something interesting that I would also like to point out as we're emphasizing on the role of tech is, even though yes, tech is playing a significant role, there's also a conversation around equity around technology and digital health. How do we ensure that we're also not increasing that divide? So we know that because of maybe the weak socioeconomic capacity of individuals, their low level of education, etc., they're often disadvantaged and may not get access to healthcare services. But this also is highlighted in terms of access to technology and digital tools. And then if we're focusing on prioritizing lots of our service delivery and just leveraging technology, how are we ensuring that we're carrying this group along and not also, worsening the inequity that these groups already experience? So what I often toot is really thinking about design and having that at the center of whatever technology we're building. And this is me coming as an improvement expert, not really a tech expert, even though I am now in the health tech industry, but primarily as an improvement expert. So when we talk about patient-centeredness, and this is really where there is a huge intersection between tech and all of that. How do we ensure that the user is at the center of what we're designing? How do we ensure that their needs, their pain points are prioritized beyond my goal as the startup, as an entrepreneur, beyond what I think or what I've heard? How do I ensure that I'm taking the realities of the users, potential users, into whatever it is I'm building or I'm proposing, proposing as a tech solution to health issues. So I think that's one of the key things. And we've seen that this actually drives adoption, because when you make the users, when you pull in the users and make them part of the conversation, actually not just the conversation, but putting them right in the process of your implementation as well, we see that the uptake of whatever solution increases. So it's important for us as experts in the tech industry to prioritize that and make that a focus for us. We understand that technology plays a critical role, but we also need to make sure that we're not deepening the divide around inequity. So I'll also push that we focus on innovation as a whole, right? So technology is one piece, but innovation is a broader piece that may or may not leverage technology. But we'll still be shifting things and disrupting the space. Thank you.
Thank you, Dr. Temi. The last part of your response is just a perfect segue for my next question for you around quality improvement, which as we've seen from your profile and your background is such a fundamental part of your work, followed closely by a passion, for public health and population-based interventions. With your experience, can you share with us the relevance of quality improvement and sort of the patient-centered building blocks in designing these healthcare innovations, which you've just said is a broader piece of the conversation, and how these can contribute to improving patient care outcomes and strengthen the health system as a whole?
Thank you very much. So ultimately, right, when we're coming up with solutions for healthcare challenges, it's really to improve health outcomes. And that's also what quality improvement is seeking to achieve. We cannot talk about universal health coverage without talking about quality of care. So while we're trying to ensure that people have access to care, it has to be of good quality. There is a popular definition of what quality is, and it is giving the right care to the right person in the right manner, the right time, all the time. If you even just think about that statement, you can't achieve that without leveraging technology. So again, we are proponents and preachers of leveraging technology. So quality improvement, we've seen how technology plays a big role in improving health outcomes. But again, tied to some of my earlier points, we also have a popular saying in quality improvement that not about me without me. Imagine planning a wedding and you're not involving the groom and the bride in the process of planning. That's what it sometimes seems like when we're developing and designing tech solutions in healthcare, where we don't often have the care providers in the room, we don't have the patients and potential users in the room as well. So how are we designing these things with them in mind? And so we may preach patient-centeredness on paper, but in reality, how are we making an effort to make that a reality? I know that there are several challenges that come with that. It can actually be a long drawn process. But ultimately you're more likely to get better results towing that road. And that's what we keep pushing for, particularly even at CC Hub. Our name is co-creation. So at the core of it, we're co-creating with the potential users. And we've seen how that has improved the work that we do tremendously. So again, when we're thinking about quality improvement, patient-centeredness is a key pillar in quality improvement. When you hear the quality improvement experts talk about quality improvement and they're trying to describe quality improvement, patient-centeredness always has it's like a standalone element and piece in describing what quality improvement is all about, because we understand the value that the patient lens brings in the process of improving care. And that's the same approach that we would implore health tech enthusiast entrepreneurs to take, as well as the designing solutions. Thank you.
Thank you. A big takeaway for me from your response is inclusion, right? We can't design without inclusion. Thank you very much, Dr. Temi. My next question is for Mr. Ene. I want us to talk about data briefly, because data is often, it seems like a murky water that no one really understands how to get a handle of it. I want to ask, what are your thoughts on the relevance of data? Now, this is across the scope of collection, analysis, reporting, management, etc. And what are the lessons that healthcare leaders or digital health enthusiasts need to learn as regards data to enhance the effectiveness of our digital health solutions and ultimately, the quality of care for patients?
Thank you, Liz. So I will basically say that, we're talking about patient-centeredness, and the core of patient-centeredness is around quality and affordability. Okay, and affordability in this sense is not about being cheap, and if you look at most of what we have today, the virtual care platforms and other digital health services, we can see, everybody can agree that access has grown, and they are bringing the cost down, but are they really affordable? I can't say that they are affordable, okay? Because affordability means that money I spend today, I still get the value tomorrow, okay? But because the data is not available, then the affordability is not there. If I go to a hospital A or a lab today and I do a scan or a lab work, okay, and I have to go to another hospital tomorrow and I have to repeat that lab work because the data is not available, then healthcare is not affordable. So it's not about being cheap, okay? I agree with what Chibuzo and Temi has said, but in terms of affordability and the quality of service, that's an area where we still need to work on. And the only thing that can help us achieve that is data, okay? Healthcare operation is mission critical and it's fueled by data, okay? So for us to have a good outcome, interventions, we depend a lot on historical data, and tech can help us achieve this historical data, as opposed to what we are used to before, current files are around. Okay, so for a patient-centered digital health, that drives patient engagement, it will be centered on data. So our solutions must help us to capture data correctly, process them, store, share, report, and equally offer security to patients' data. That's my opinion on data. Thank you.
Thank you, Mr. Ene, for that response. It's an interesting angle to see how that without data, affordability of care comes into question. Thank you very much. Dr. Chibuzo, I would like to ask, drawing from your expansive sectoral experience, working both in the public and even in the international space as well, especially around policy and your work around reforming regulations. I'd like us to talk about policy and regulatory frameworks. How can we manage multiple stakeholders across both the public and private health space? Excuse me, please. I need to. All right. Apologies for the interruption. So I'll take the question again. Drawing from your expansive sectoral experience and work around reforming regulations and policy, I'd like us to talk about policy and regulatory frameworks. How do we manage multiple stakeholders across the public and private health spaces and secure their buy-in to design and implement policies that advance patient-centered digital health solutions? And from that same standpoint, how do we strike a balance between fostering innovation and protecting the safety, rights, just like Mr. Ene mentioned, and privacy of digital health users, solution users, ultimately?
Thanks for that question. See, that question is it's a multi-layered question, and in trying to answer it, I'm going to touch on a number of things that are pertinent to what's taking place in the industry space at this time. The first thing is that these digital innovation that we refer to oftentimes are born or birthed in spaces that are not yet regulated, right? And sometimes the current regulation might not necessarily understand or be sufficient to work with them. And so the approach to those type of regulation is a bit different from areas that have mature regulation. So when you want to bring a pharmaceutical product to the market, for instance, it's very clear the stages and what needs to be done and how to, and businesses have sort of, so the ecosystem has sort of, gotten used or the market is already aware of how to do that. But when you're talking around the use of artificial intelligence in diagnosis, right? Or artificial intelligence in care delivery, regulators have not caught up to how that might be a good or a bad thing, or how to prevent, and as such, the approach to elaborating regulation and enforcing regulation, which is a key component of regulation, because it's not just about writing out the policies. It's more important to craft policies that are useful and meet the end needs of all the stakeholders in the space. And so one thing I'd like to mention is just that oftentimes in the space there are different approaches to different markets and different not different markets, but different levels of maturity in the market. In some areas, I'm a proponent of heavy is the wrong word. I don't use heavy, but I'm a proponent of a lot of engagement. And in some areas, I'm a proponent of light touch and things. But at the end of the day, in the healthcare space, what you find is that there's a lot of co-creation between the providers and the technology people, or you would want to have a lot of that. And so you would want, in those initial times, to have some sort of self-regulation from providers. While in more mature markets where things are very clear, you would want to have more standardized, and that's my thought process around that. Might not necessarily be best approach, but I think it's the most pragmatic approach at the time, being that once you elaborate regulation, a key part is enforcing it. And if you're not clear or don't understand or don't have particular insight into what's happening, it then becomes very difficult. Or you might end up killing a nascent market or doing more harm than good when you try to get involved. But it is important for innovators to sort of come together and create that safe space to engage with regulators, where regulators can sort of understand what innovators are trying to do. Innovators can understand what regulators are trying to achieve, and people can come and work together. And there are a number of successful co-creation type of policy things that I've been involved in, and things like that. Having said that, some of the dangers of pushing regulation that is inefficient is, you have in certain industries where in the urban areas, everybody is super regulated, and then in the rural areas, there's no regulation. So anything goes in the rural area, leaving, people who oftentimes are not as, for lack of a better word, empowered as people in the urban area to fight rights, to be at the mercy of this, unregulated market happening. While in the urban areas where people sort of are even more structured, there's a lot of regulation and people are bearing, and this has to do with the uneven landscape in implementation of policy. So I guess with this nascent health technology space, if I wear the hat of an entrepreneur, I'm like, I just want to keep going and doing my thing. But I do realize when you wear the hat of the regulator that you need to have a handshake. You need to have transparency. You need to have trust on both sides.
Mm-hmm.
And you need to have a common framework that you're working towards without necessarily having an overbearing architecture in the beginning. These things can be developed, further down the line as the markets mature. Those are my thoughts around regulating the space. In terms of privacy concerns and data protection, Nigeria has the NDPR. For those of you that don't know it, you should get familiar with it, because they do. We go through a yearly audit with them. We don't handle patient data, but anyone who handles patient data will be going through those types of audits. There's also the GDPR European thing. There's the HLA, the HIPAA standards, and there are a number of standards that you generally want to conform to, not for the standard's sake, but also from the perspective that, in healthcare, they tell us first, do no harm. And you don't want to be accessing patient data and letting that out on the loose, because that could do a lot of damage to a patient.
True.
Or even your treatment or drug starts to take effect. Those are my thoughts around regulating the space. Thank you.
Very insightful. Thank you, Dr. Chibuzo. So at the HLA, one of the things that very important to us is, driving leadership, building capacity in leadership, and generally just being interested in raising the next generation of leaders in healthcare. And with the very interesting way that Dr. Chibuzo put it earlier about how that in the next couple of years, we would have organizations using technology. I want to ask Mr. N a question around, and this is around his own extensive experience driving innovation into enterprise scale services. What are some of the essential skills or lessons that you've had to learn that improved the odds of sustainability for you and profitability by extension? And what are your thoughts on the gap in learning for existing and potential digital healthcare leaders? And how can we increase opportunities for mentorship to increase representation in this space?
Thank you, Liz. Okay, for me, improving sustainability, basically, there has been a lot of mention here around co-creation, basically creating with the ecosystem. A while back, I think sometime late last year, there was a multi-stakeholder workshop organized by WHO and Federal Ministry of Health, where we all, participated. And it's all about digital health. It's all about how do we grow digital health, how do we standardize and make it more impactful within the larger society. Okay, so in building an enterprise digital platform, I think the most important thing is user feedback. You need to get feedback from your users. You need to test. You need to iterate, and where you can, you must co-create. And again, you must stay agile, to be able to adapt, the feedback you have gotten from from your potential audience or potential customers, and make sure that you're creating valid needs as opposed to building what you think that they want. Okay, so going to the learning gaps that we have and how we can create skilled digital health leaders. I think the most important thing, or one important thing, it's from a regulatory point of view. We need to be, our regulatory environment, we need to be very clear on, our national digital health strategy and objectives by extension and scope. Again, talking about standards, during the workshop last year, nobody was clear about what we're adopting, whether we're going FHIR or whether we're going IHE or any other thing. So I think that those need to be clear so that emerging leaders in digital health development will know exactly where they stand. Having said that, it's not as if once you start developing, you're looking to interpret immediately. But standards are basically standardizing your nomenclature, standardizing your data structure so that eventually when you want to open up your APIs for interoperability, it's a lot easier for you to do. Another thing that I think we need to do is to align ecosystem, align everybody within the ecosystem, from vendors to providers, to payers and regulators. Another thing, it's as a collective, we must move to, collaborate and educate, the audience across the board, from patients, to providers and people who work within the provider community, to payers and the rest. And again, I think we need to begin to, promote patient-centeredness as a strategic objective for healthcare providers. I saw someone ask a question in the chat room earlier, asking whether patients and providers are adopting the innovations that are being produced. Okay, what I think that is equally lacking is information education and a bias against change. Most people have not adopted that culture of change. So it's something that can be done collaboratively. HLA and all the other healthcare vendors, WHO, Ministry of Health, can actually come together to drive a common education, a common awareness. Something similar to when back in the US, I think you have Got Milk, which was a campaign that was collaboratively done by people in the dairy product, in the in that sector. So I think a similar thing will help to advance adoption and promote awareness equally amongst health IT leaders. Thank you.
Brilliant. Thank you very much, Mr. Ene, which is just the perfect plug to sort of just link or tie in one of the programs that we do here at the Healthcare Leadership Academy around patient-centered care, and it's upcoming the month of August. For healthcare providers to understand some of the building blocks of patient-centered care, improving patient satisfaction, and ultimately improving the sustainability of your healthcare organization. Thank you to everyone who was sent in questions. We'll just quickly, just dive right into it because our question bank is flooding in already. Oladoyin, thank you for sending your question. Oladoyin is asking, would you say that the users of these digital innovations are ready to accept these innovations? Example, the acceptance of telemedicine by patients in our environment. You find that most patients still come into the hospital even after he or she has had a virtual consult. Dr. Temi, I would like you to take this question. What's your thoughts on this?
Thank you very much. As with anything, when we're introducing change, there's usually resistance. Technology is no exception. Dr. Sego, good evening, ma. So we know that technology, yes, it is important. We know all the values, all the benefits of technology, but we can't take away the fact that healthcare, there is a personal touch to healthcare, either we like it or not. And patient, and I'm speaking as a clinician first, and also as a patient, right? There's something psychological about your care provider palpating the sites that you're complaining about, and having that one-on-one physical interaction that technology cannot necessarily afford you. So I think there's a lot of mindset / behavioral change that needs to happen for people to fully adapt and adopt the use of technology. And like many things in life, it would be a long-term journey. We would have to keep preaching this and hoping that people are more open to it. I mean, where we were in the thick of COVID, we didn't have a choice, right? Patients that didn't have critical conditions had to, and we wanted to see their care providers had to do this virtually. So I know that, yes, we're really pushing for the use of technology to be adopted, but it is a journey. And we will have to keep working on the mindsets of the users. And, like some of the reasons why maybe they're not adapting technology or use of telemedicine, for example, maybe we can get some of that feedback from our patients and see how we can incorporate into our solutions. That might also be a good way. But in general, I think there has been definitely some improvements. We're not where we would like to be, but maybe working on the mindsets, working on the behaviors that might push us closer. Also thinking about the care providers as well, there are certain biases, right, that they're probably pushing around the use of technology. So there's also that work that needs to be done. It's not only from the patient perspective. So just looking at it holistically and being mindful of the fact that it will take a while to get there.
Thank you, Dr. Temi. I like what you said about feedback, very important. And then the next question is for you from Samuel Amao. Is asking, how's your agency able to interface between the voluntary blood donors? I'm guessing this has to do with your work with BloodPlus initiative. How is your agency able to interface between the voluntary blood donors, the Lagos State Blood Services Agency, and recipients of donated blood or recipients of donated blood?
Thank you, Dr. Amo. So BloodPlus, we're actually that interface. So we're the ones who try to pull together, we sort of stand as the bridge between the donors and the agencies. And that's sort of where our work, the focus of our work is. But in addition to that, we work with the agencies to think about innovative ways to address whatever challenges that they're experiencing. And I talked about some things around like data and how fragmented the system can be at times, and logistics. Those are some things that we're helping them think through. So in the data components, we have issues around, knowing where the blood is going. So we can't always track blood and in real time. We can't tell if the blood has been used. We would have to follow up in a certain way, which is not the most efficient to follow up on blood utilization and things like that. So there are still so many gaps between the blood agencies and the recipients of the blood. And these are things that we're also trying to work with agencies to innovate around. It's been very interesting to see, and even COVID further complicated the entire system. with blood donors reducing drastically, and also the need for blood going up. So we've had, a lot of challenges around that, but we are still trying to do the work that we can. We understand that we can't do it alone. So there are several players in the space as well that are contributing to this work. Yeah, thank you.
Thank you, Dr. Temi. So our time is fast spent and we apologize for the time extension, but I would just like our panelists to just, take 1 minute each to, in their respective opinions, just share final thoughts on innovative approaches that everyone in the healthcare sector can play a part in to foster sort of like a system-wide advancement of digital health solutions. Some of the practical advices that you can offer to both medical and non-medical professionals in the audience this evening seeking to create digital health solutions, especially in our healthcare landscape. So I think we would start with Dr. Chibuzo.
Thank you. I think for those of us who are trying to foster, change that is driven by digital health technology, I think it's important to not focus on the change as change for the sake of technology or technology for the sake of technology, but rather focus on the innovation and the the final output or outcome for the patient and the process you're trying to do, and technology just being that enabler that makes it happen. And that for us, focusing on what the client wants and how to meet the client's future needs and how to continue to wow the client, that is what essentially drives that adoption and drives that thing. People generally get excited about technology, because it's a lot of people. We're living in a generation that people are beginning to take technology advancements as the norm. So that sort of happens, right? But at the end of the day, the real healthcare needs or business needs that drive the raison d'etre for these products. And as an entrepreneur, if you focus on those and focus on the real things and not just the shiny bells and whistles, I think long-term you are an essential part of delivering a need and a service rather than being the next best thing that is out there. Those are my thoughts.
Impressive, wonderful. I think I like that perspective, more about the service you're delivering as opposed to the clouds and all of that. Thank you very much, Chibuzo. Mr. Ene, I keep calling you a doctor. I sense that something is coming. So, Mr. Ene, I think I'd like you to share your perspective, final words on some of this innovative approaches that everyone can be a part of.
Okay, thank you, Liz. Yes, I don't think there's a scarcity of innovation, in the health tech space. I think, across globally, a lot of people have done some very fantastic thing, in health tech, from what exists in Nigeria today, from virtual health to, fancy supply chain to, marketplaces to, a practice management solution to aggregation or a combination of practice management solution and marketplace. Okay, a lot of things, even in blood banking and gene therapy, a lot of things have been done. Okay, we can choose to adapt existing innovations or develop new ones. Okay. However, the most important thing is if we're driving patient-centered digital health solution, the reasonable thing to do is to make sure that we're building for patient engagement. Okay. And for us to build for patient engagement, it must offer the 4 primary care core functions, which are contacts, okay? Making sure that at the point of contact, the patient can use the application. The second one is comprehensiveness. It's the totality of what you have built, what you're offering patients. Does it cover the full range, of the healthcare services that patients will most likely require? Then the other thing is coordination. right? When you offer this solution, are they enabled to provide, patients to coordinate healthcare from one provider to the other? Okay, and the final one is continuity of care. Now, when you look at all these things, it goes back again to data. Okay, so the only thing that we can collectively do, to advance, the cost of digital care and provide the right, create the right impact is to begin to standardize, right? So once we begin to standardize, naturally, at some point, we begin to interpret. At that point, we'll have enabled full patient data mobility. So a patient can move from one provider to another provider without losing data. A patient can migrate from one HMO to another HMO without losing their data. So I think our focus as healthcare, digital healthcare leaders, should be on standardization. Thank you.
Thank you very much, Doctor. And since the doctor is in my mouth, let me let it go.
Engineer,
you're in the presence of doctors, so
Yeah. I'm blessed. I am blessed.
So thank you very much, Engineer Ene, for that very comprehensive, response to the question. And finally, Dr. Temi, I would like to hear your final thoughts on innovative approaches for everyone to collaborate.
Thank you very much. I think there really isn't much to add to what Dr. Chibuzo and Dr. Eme have said. But I think really and truly, everybody has a part to play, starting from leadership to the institutions and then the individuals. For those at the macro level, at the sphere of power, demonstrating real political will. I think that's something that I would really, want to encourage. How do you put your money where your mouth is? So we know that we're talking about using tech and making that, part and parcel of healthcare, but how do you support that? How is it evident in budgetary allocations and in the policies that you're putting out? Dr. Opara talked a lot extensively about, regulation. How are you creating an environment that enables, spurring of technology and innovation within the healthcare space? At the more meso level, so with the innovators, I think we've dealt extensively on that topic, thinking about patient-centeredness and having, the user at the center. Really, we cannot run away from it. It might be a stressful process, but that is really the only way to go if we're thinking about disruption in the healthcare space. That gives us the most bang for our buck, right? Closely linked to that is the adaptability of health tech solutions. How are we ensuring that we're responsive to the changes and the needs? So we do have, brilliant solutions, but maybe we require tweaks here and there. How are we able to ensure that we're making that available to the users? And lastly, to the users is, we have to embrace technology. It's new. It can be difficult. You may have to unlearn so many things and start relearning new things, but we have to embrace technology. It is here to stay. So what ways can we, make that a reality for us in our day-to-day as well? So I think those would be my final words to the different people who are involved in this entire process. Thank you.
Thank you so much, Dr. Temi. A big thank you to our esteemed panelists. This has been a very insightful, well-rounded and eye-opening learning session this evening. Thank you for the seasoned insights you shared. I think something that comes across is the fact that we're not doing so bad. There's some measure of progress that's been achieved. And of course, that's hope for the journey ahead for what's to come. So I want to thank you once again for coming on this session and, but through your insights, providing takeaways for everyone today, several takeaways, regardless of the levels or spaces in which we work, and these takeaways will continue to help sort of advance collaborative pathways that we can all pursue or explore to further foster the adoption of digital health solutions that will strengthen our health systems to be patient-centered. So thank you very much. Ifeanyi, I can see that you have a very interesting question, but I would like us to continue this conversation because our time is fast.